Now, the Hospital Association of South Africa is hosting its annual conference under the theme Innovation and the Future of Healthcare Provision. The gathering brings together healthcare professionals, policymakers and industry leaders to try and explore new technologies, policies and partnerships that are shaping the country's health system. SABC News reporter Katlego Legodi is watching the story. He joins us now live from Sandton. And Katlego, if you're able to hear us, I imagine one issue that you can't avoid in a gathering like that is the controversy of the NHI.
Very good morning to you, Ayanda, and to our viewers at home. You're right. I mean, this coming through at a time when we know very well that HASA, the industry body, is in court with the government around the national health insurance. This will be one of those issues that will come under the spotlight in the coming 2 days in ensuring that at least everyone here is well informed in terms of where that particular process is. It's all about universal health care, and you hear those from the medical aid side and the private, healthcare funders or private healthcare providers just talking about how they would want government to revisit this process of introducing universal access to healthcare in the country. And most of them here will be looking to ensure at least that they plan to the future. And this NHI, is it to be or not to be? Looking at how then these conversations will take shape going into tomorrow. But here we find various of those role players in this space. We're told that there are about 200 of those that have flocked into the Sandton Convention Center, and they're looking at ensuring at least that they add their voice in terms of the future of healthcare provision in South Africa. I'm going to bring the HASA CEO into the conversation with us this morning, Dr. Bomela, who'll just give us a sense of how then we find Dr. Bomela, excuse me, pardon me there, how we find ourselves here today. I know very well that the conversations that will be taking place inside, we're in the exhibition space inside, they're looking at actually planning for their country in ensuring at least as well that the sustainability with healthcare provision is concerned. Welcome to the SABC. Give us a sense of how we find ourselves here today.
Sure, thank you. So this wonderful event that has been put together by our team is something that we get year after year. It's got a very long history of debating issues that are pertinent to healthcare. And in your introduction, you emphasize how pertinent healthcare is. And it's precisely the reason why we have this event, because we have here society, so to speak, people from all walks of life that are impacted on or that impact on healthcare. So if you look at our themes, they are designed to address exactly those pertinent issues in this sense. If you look at we've got a whole period within the program that is dedicated to leadership. And we've also got more that is going to talk about innovation at this point in our development in healthcare and in society. Innovation is a big word that's floating around, and that's one of our themes. And of course, where would we be in healthcare if we were not discussing and thinking and innovating about quality of healthcare? And that's another theme that is going to come out very strongly in the program. And of course, as you've mentioned in your introduction, it's people from all walks of life, and there's uncertainty. We all are striving to move towards universal care, universal health care, universal access to health care. Sorry. And so it's really a wonderful event to have at this time. These issues are topical, and the one thing, though, that I would like to emphasize that is an inspiration to all that will be happening at this conference is the fact that first and foremost, we're looking at the patient. We're looking at the benefit of what we are discussing here must be for the user, for the healthcare user, for the patient himself or herself. So you will see there will be a lot of emphasis on that during the deliberations in how the matters that you are discussing impact on the patient. Patient comes first for us. This conference will reflect very clearly on that.
Yeah. Whilst we still have you here, you're speaking about access to universal health care. What are some of the issues that worry you as those that are within this space where healthcare provision in the country is concerned? What becomes a burning issue for you that you reckon as you continue to meet year in, year out, you need to ensure that you solve for that? What becomes that issue?
So we need leadership. We need brave leadership amongst ourselves to confront the issues. And if you really look at what's been holding us back, it's been ventilated on many platforms that we all are. There's no unity in the way that we pursuing the universal health care, and we need conferences like this to bring us together and try and get some convergence through discussions such as this. So I think we need a unity of purpose as well as a unity of action. And we don't really see this as a talk shop, so to speak, in the sense that we see it as an inspiration for those who are attending to take insights from the conference back to their workplaces. We have people that are in very prominent, influential positions that will be part of this conference on the podium and in the audience. And those people are going to leave this conference with new insights and inspiration to continue doing the good work.
All right, Doc, before we let you go, let's talk about NHI. You've taken government to court. You don't agree with how they've rolled out this process. Maybe give us a sense of where are we, where that matter is concerned, and is this something that you're looking at championing here or giving those that are here an update on NHI?
So you've mentioned where that process is, that there is a court process that is taking its course. But our focus really is not on that. Our focus, like I said a little earlier, is what does this all mean to the patient? Our next steps and what should be done is going to be defined by that. We are now seeking to get closer to other stakeholders and reach out to government and see how do we all contribute towards the achievement of the goals of universal health access. So we're very clear what the way forward is, and the way forward really is for all of us to look at what matters most. What is the whole point of healthcare and this reform? It is for the benefit of the patient, and that's what we're focusing on as private hospitals. And this conference, you will see in the theme and the discussions that is where we're going with our deliberations.
All right. Dr. Bomela, thank you very much, sir, for giving us your time. The doctor coming through as the CEO of HASA, and you hear them just talking about how they're going to, in the 2 days, ensure that they place the patient at the center of some of these discussions here. So we're expecting various of those role players, including even government officials, to form part of this process here. But they are already here in their numbers. Some of those associations that are part of HASA. Just on my right, I see Life Healthcare. There's the Health Ombuds that is here as well. well, various of those role players, Mediclinic here as well. And these are some of the players that will really just be giving us a sense of the issues that they'll be championing as they push to ensure that there is access. But also here you hear them talking about the dignity that would come with access to a healthcare provision in the country. It's back to you in studio for now, Ayanda.
Such an important issue. Katlego Legodi is live to us there from Sandton. That's where the Hospital Association of South Africa is holding that conference. For now, Katlego, thanks very much indeed.